The coronavirus is taking a devastating toll on healthcare workers across the country. In California alone, more than 4,000 healthcare workers have tested positive. Nationwide, the numbers are likely much higher.
Our waiting rooms have turned into the treatment centers, and the hallways and the streets are running like a clinic. We're literally seeing patients on Broadway with a tent. So it's completely different than anything else we've ever done in New York. Lots of horrifying stories, things that I would not expect to witness in a first world country, in a high resource country. So it's been mentally and emotionally and physically exhausting.
Dr. Sion Ferreu was sent home after multiple exposures and apparent symptoms.
Initially, I was a bit in denial because it just felt exhaustion from having worked in a hospital and saying, I'm just probably burned out, or I'm just lacking good sleep.
But Dr. Ferreu faced an unexpected challenge.
Because of lack of tests, I couldn't get tested those first 3-4 days. I had called my department, I had called the Department of Health in New York. Basically, at this point, since your symptoms are mild, we recommend you stay at home, which is what I've been telling other patients, that I thought it would be a different narrative, at least for providers.
A shortage in test kits led to major delays in widespread testing.
It's horrifying because we're seeing this trucks parked outside because our morgues are full. I wish we had done that in New York, or as a country in the US, had taken most of the actions a lot earlier.
With the highest number of cases in the world, the US fell dramatically behind in testing early on.
I got sick at work, and I thought I had the virus. I really did. I just got really sick, but it was something different. But I went to the hospital. Work would not let me go back until it was 100% clear. They did not want to test me. They just wanted me to go in there and do the screening and then send me out. I'm like, no, I want to be seen by a doctor. I want to be tested thoroughly. If we do get sick, we don't get paid for it when we're off work. So that's a little slap in the face.
At my hospital, where nurses were sent home, was because they were working with COVID patients and wanted to wear the N95 respirator masks, and were told they could only wear surgical masks. Meanwhile, all the doctors were wearing their respirators. So I did attend a protest at my hospital when we were just requesting PPE, just basic PPE for taking care of COVID patients and non-COVID patients. We were just scared and wanted to be able to wear masks at work.
A 30-year-old anesthesiology resident in California, who asked to remain anonymous, prepared for the worst.
You hear these stories all the time, and it's really difficult not to think about your own mortality. So in preparation for my time in the ICU, I did work on my own advance directive and talked to some family about, what my wishes would be.
We need to look at the systematic errors here. It's really sad to see people individually dying, but we need to take that to the next level, which is how do we improve the system? The thing that I never expected really to see is being in the United States and having to make those decisions, or seeing my colleagues who are watching people die without resources.
I think this generation of medical providers have witnessed something so grave that it's going to change us permanently.